I'd like to welcome all of you to our podcast today, the Clinical Nurse Faculty Shortage. I'm representing the Public Policy Committee of the National League for Nursing, and I'm happy to be here and can't wait to talk to our two panelists who are experts in the field and can give us some insights on the clinical nurse faculty shortage. So first, Dr. Tracy Ortelli. She currently serves as the Galen College of Nursing President and Chief Academic Officer. She joined Galen in 2008 and served as the college's first Vice President of Academic Affairs. During her tenure at Galen, a few of her major accomplishments include providing leadership for the development, implementation, and evaluation of the college's nursing programs while ensuring quality during a period of robust growth, establishing a common curriculum and assessment, leading the work required to establish Galen College of Nursing as an NLN Center of Excellence. Prior to joining Galen, Dr. Ortelli worked for the National League for Nursing, where she assumed primary responsibility for the creation of the Certified Nurse Educator credential. In addition to ensuring the high quality of these exams, her work helped establish nursing education as a specialty area of practice. For the first 15 years of her nursing career, Dr. Ortelli's clinical practice was in the medical, surgical, emergency, and cardiovascular intensive care unit settings. Dr. Ortelli has presented at regional and national conferences, is published in peer-reviewed journals and in nursing education texts, and serves as a co-author of the seminal work, The Scope of Practice for Academic Nurse Educators. Dr. Ortelli is the past president of the New Jersey League for Nursing. She currently serves as the coordinator for the nursing resource column that appears in the AJN, is a member of Sigma Theta Tau International Honor Society in Nursing, and was inducted into the Academy of Nurse Educator Fellows in 2012 and the American Academy of Nursing in 2021. Dr. Ortelli obtained her PhD in nursing from Nova Southeastern University, a Master's of Science degree in nursing from Columbia University, and a Bachelor of Science in Nursing degree from The Ohio State University. Next, we're going to have Dr. Julie Moody. With nearly 40 years in nursing and 28 years at Cincinnati Children's, Dr. Moody provides strategic leadership as the clinical director of education. She leads a team of 18 professionals managing student services for over 1,500 nursing students annually, including clinical rotations, role transitions, dedicated educational units, co-op placements, and summer programs. Julie's team also teach clinical rotations through hospital partnerships with nursing schools. In addition to the student programs, Julie oversees onboarding, adult to pediatric transition, and the RN residency program, achieving PTAP accreditation with distinction in 2020 and reaccreditation in 2024, underscoring her commitment to excellence in nursing education. Her career spans perioperative nursing, recruitment, and education, supported by advanced degrees in nursing, education, and a doctorate in nursing practice. Julie is also board certified in nursing professional development. I'd like to welcome both of our panelists to the podcast today and looking forward to this conversation. So my first question is for Dr. Ortelli. When you hear the words nursing shortage, people often think about bedside nurses. Why is the clinical nurse faculty shortage just as critical, if not more so?
Well, thank you for that question, Dr. Denker. The reality is that hospitals can hire more nurses only if schools can educate them. And schools can't expand enrollment without qualified clinical faculty. So in practical terms, the faculty shortage is a supply chain constraint. Without enough educators to supervise and educate students in clinical settings, we can't produce the number of nurses who are ready to transition to practice that the healthcare system needs, no matter how strong the demand is.
No, I think you made some great points there, and yeah, if there's shortages everywhere, the educational community is suffering those same challenges. And so, to further expand on that, are there regulatory or accreditation requirements that unintentionally make the shortage worse?
There are some very well-intentioned regulations, and this is all on a continuum, and in a lot of ways, it's nuanced. But in some cases, there are really strict faculty qualifications that may not be a one size fits all, particularly if we're talking about rural areas that don't have the same supply of nurse educators. So when we have these very strict, unwavering faculty requirements, including licensure requirements in border states, and educational requirements for the clinical setting. That could really be a barrier to expanding access to nursing education. Another challenge is in some of the regulations related to the low faculty to student ratios. And that's not necessarily just Board of Nursing regulation. We also have situations where hospitals will set their own criteria then for the student faculty ratio. And so that can also be a barrier because a barrier to that. One other thing is simulation limitations could also unintentionally make this shortage worse because it can constrain a school's ability to scale. So what I want to say though is these standards and criteria, they are there to protect quality and patient safety, but they can also reduce the flexibility at a time when faculty are in short supply, which makes it harder to expand capacity even when clinical sites and student demand exist.
Yeah, yeah, I think you hit the nail on the head there. We are very well intentioned, but we do have limitations everywhere, and it does prevent us from being able to enroll more students. So, Dr. Moody, moving on to you, since you work in a healthcare facility that accepts nursing students, how can health systems and nursing schools work together differently to address the clinical faculty shortage? And what successful models have you seen where practicing nurses serve as clinical faculty?
Yes, thank you so much for having me here today. So this is truly a topic that I am passionate about. So we have a great model here. So as you know, traditionally nursing students or nursing schools hire faculty directly, but that's it's tough when the qualified instructors are in short supply, as we've just heard. So here at Cincinnati Children's, we've really flipped that model. So instead of the schools hiring the faculty, we hire them. We hire them through the hospital. We have a mixture in my team of both full-time faculty and optional PRN faculty, and they're nurses, and they're in the teaching roles. So I have the full-time faculty who teach clinical traditionally in the fall and the spring semester, and then also a little bit in the summer, although we don't have quite as much demand in the summer. And then I do have some PRN, and these are clinical, I'd refer to them as faculty, but they're clinical instructors. We have some PRN as well, optional. And they just tend to teach in the summer, in the spring, sorry, and the fall. And my full-time faculty, you might say, well, how do you justify having full-time FTE? Well, over the summer, we do have other programs where they teach in our student programs. We have some high school programs as well as some other student programs in the summer. And they also teach in onboarding. And as I said, these instructors are paid through the hospital, which makes it easier for us to attract the clinicians who want to teach but still stay connected to the practice. And then we bill the schools for those instructional services. So it's really financially sustainable for us. The instructors do provide orientation for other instructors that come in because we don't teach for everybody, just for a few schools that come in, but it is growing more and more for the ask. And then those instructors are hired onto the schools as non-paid employees. So they have access to the grading platforms and the academic systems as well. And that way they function just like the clinical instructors who work for the school, but work for us instead. The paycheck comes from Cincinnati Children's.
Wow. That's an amazing model. And as I understand it, this is not a new program. This has been around for a little while.
Yeah, absolutely. This actually, my predecessor uh, came up with this program when we had a different faculty shortage back in 2006. And that model has grown since then. I think at that time we had 3 clinical instructors, and we are now up to 22 clinical instructors that work with us for us.
Wow. That's amazing. And what a great model. So further expand on this conversation, what are the benefits to the hospital when they invest directly into nursing education and these faculty roles?
Yeah, that's a great question. So for the hospital, it isn't just about filling the gap, right? It's a strategic investment for us because by us supporting this nursing education, we strengthen our future workforce pipeline. We know that students who train with us are more likely to join our team after their graduation because they've already had that real world experience and they've learned to understand our culture and our clinical standards. It's it also helps to ensure that what is taught in the classroom aligns with our real world practice. My instructors have very close relationships with the schools, and so they can keep everybody updated on what that real world practice looks like. And that really does improve patient care, right? Because after all, it's all about the patient in the bed. And honestly, as well, it really positions the hospital as a leader in the community, showing us that we're committed to advancing the profession, not just hiring nurses. So it's a win-win, right? It's recruitment, it's retention, it's quality and reputation all rolled into one.
Oh, I love that. I love that. And I do think that you're definitely controlling the quality of the education, which is I know music to Dr. Ortelli's ears to hear that you all are doing this. So, Dr. Ortelli, you mentioned earlier in the conversation simulation. So, what role can simulation technology or alternative clinical experiences play a role in easing the faculty constraints without replacing real world practice?
Well, high quality simulation and technology and even alternative clinical experiences can provide specialty nursing practice experiences that might not be readily available in the healthcare setting, such as OB and pediatrics. These methods can also extend faculty capacity by allowing an educator to support students' education while maintaining consistency and safety. And when we use these intentionally, simulation can strengthen clinical judgment, teamwork, and readiness before students enter live patient care. It also provides a very safe space for students to learn. Now, I want to be really clear, simulation is not a substitute for hands-on clinical practice. Rather, this is a force multiplier. It helps schools use limited faculty time more effectively while preserving hands-on clinical experiences.
Mm-hmm. Yeah, I mean that's so important. We have to have a nice balance
Yeah.
of both the hands-on clinical in the facilities with this time for them to practice these real world situations and I've been in some of those sim labs and they're pretty realistic. So love to see that. So going back to you, Dr. Moody, just a final question for you is what gives you hope in the current nursing education and workforce landscape?
Yeah, another great question. So what gives me hope is the creativity and collaboration that I'm seeing between healthcare systems and nursing schools. For years we've operated separately, we've operated in silos, but now we're building those partnerships, which is truly a game changer. At Cincinnati Children's, we've closing that practice academic gap, and I'm hopeful that others are closing that gap as well. You know, it really shows the willingness to rethink old models. With hospitals investing directly in education, it strengthens the pipeline, ensures that students are learning from clinicians who are actively practicing. So it's creating that sustainable, high quality approach that benefits everyone, schools, hospitals, and most importantly, the patient in the bed. And the partnership help us move towards a future where education and practice are more aligned. And that's exactly where we need to be to grow the future of our nursing workforce.
No, that is exactly right. Thank you for sharing that. Dr. Ortelli, what is one message that you want to send policymakers or regulators to hear very clearly from nurses?
Well, this is a very timely question, I might add. But I think what's so important for policymakers or regulators to understand is that their policy decisions, even if they're technical or administrative in nature, they send powerful signals and they have a real workforce consequence. Give you an example, the recent action such as removing nursing from the federal definition of professional degree might not have been intended to diminish the profession, but this can now make graduate education less affordable and further constrain the pipeline of advanced practice nurses and faculty. I will say one thing that I think, if there's a silver lining in this, it has rallied people, even outside of our own profession, to take a step back, including lawmakers, to take a look and to really understand, again, to reevaluate the value of nursing. So it is encouraging to see the response to that change that was made. If we want to solve the nursing shortage without compromising quality or access, we need to make sure that our policies are aligned across education, workforce, and healthcare delivery. And they must actively support, not inadvertently weaken, the faculty pipeline that makes the entire system possible. And I know you only asked for one, but I'm going to add one more. And I'm going to say that, I think another thing is that things such as loan forgiveness or tax incentives or grant funding are very critical to attracting nurses into faculty roles, because these incentives directly address one of the biggest barriers to academic careers, and that's the financial trade-off. Loan forgiveness and tax incentives can narrow that comp gap between clinical practice and teaching, and grant funding can support protected teaching time, faculty development, and academic advancement. And so together, these tools make faculty roles more economically viable, and they signal that educating the next generation of nurses is a national workforce priority, not just an institutional one.
Wow. That's a great note to end on, and you both have been so insightful, and what I hear is we got to work together. We got to have better communication and better relationships, and it's across the board, not just the academic and the clinical partnership, but it does need the support of our federal government, our local governments, our state governments, to make sure that policies aligned involve the front line, the educators and the clinicians in policy making, so that we can support generations of nurses to come. Well, I hate to end this because I could just sit here and talk all day long with both of you about the clinical faculty shortage, but I know we need to end the podcast. But again, I just want to thank you deeply from the Public Policy Committee and myself for you all volunteering to come and speak to us today and provide such valuable insight into the clinical nurse faculty shortage. Thank you.
Thank you so much for having us.
Thank you.